Tobacco is one of the most widely abused substances in the world. It is highly addictive. Tobacco-addicted children are the person under 20 who's smoking and need more and more tobacco to feel its effects. They will have physical symptoms or feel sick when they stop using it. When they try to quit, they will have withdrawal symptoms such as shaky hands, sweating, or rapid heart rate. They must smoke after every meal or after long periods of time without using, such as after a movie. They need tobacco products to feel normal or turn to them during times of stress. Tobacco use is one of the main risk factors for a number of chronic diseases, including cancer, lung diseases, and cardiovascular diseases. It is the leading cause of preventable death, so it's important to make sure that children understand and aware of the disadvantage of tobacco smoking, and classify the tobacco-addicted children as children at risk. Factors associated with youth tobacco use include the following: social and physical environment. The way mass media show tobacco use as a normal activity can promote smoking among young people. Youth are more likely to use tobacco if they see that tobacco use is acceptable. Biological and genetic factors. There is evidence that youth may be sensitive to nicotine and that teens can feel dependent on nicotine sooner than adults. Genetic factors may make quitting smoking more difficult for young people. Mental health. There is a strong relationship between youth smoking and depression. Personal perception, such as coping with stress and controlling weight, are related to youth tobacco use. Other influences that affect youth tobacco use include lower socioeconomic status, including lower income or education, lack of support or involvement from parents, accessibility, availability, and price of tobacco products, low self-esteem. Effects on children. Muscle and skeletal system. Studies show a direct relationship between tobacco use and decreased bone density. Smoking is one of many factors that increase the risk of osteoporosis. Respiratory system. Smoking causes chronic obstructive pulmonary disease or COPD, emphysema, chronic bronchitis, pneumonia, and asthma. Cardiovascular system. The chemical in tobacco harm your blood cells and damage the function of your heart. This damage increases your risk for cardiovascular disease, coronary heart disease, heart attack, high blood pressure. The effect of nicotine on the brain. Firstly, preclinical brain changes, including brain infraction, white matter hyperintensities, and atrophy. Secondly, single measures of cognition. Next, cognitive decline over repeated measure. And lastly, dementia. Cancer. Smoking cigarettes is the #1 risk factor for lung cancer, but smoking can affect your entire body and is known to cause cancer in many organs. Effects on community. The tobacco smoke could cause allergies and asthma. People who are suffering from asthma or allergies may also have asthma attack from secondhand smoking. Pregnant women. In pregnant women, if they usually receive a large quantities of smoke, the baby will get some effects such as disabilities, dementia, or death during the delivery. Smoke affects the children's development. The children who usually exposed to the tobacco smoke, their development will be 2 times slower than the normal kids. Economic effects. Economic loss from tobacco smoking is over 14 billion baht. The governor spent 14,000 million baht each year to treat the diseases from tobacco smoking. Primary prevention focuses on the efforts to educate and prevent children from smoking by making smoke-free laws in every state. Schools are an important place to educate children about primary smoking prevention. Programs at school that discourage the imitation of smoking and support groups to help students with personal problems. Encourage parents to have talk with their children about not smoking and health problems. Secondary prevention focuses on screening anyone who may be at risk for certain disease or disorder. In this case, it will focus on screening children who may be at risk for smoking imitation. Some of the risk factors that may lead children to smoke imitation are children who have at least one person in the household who smokers. Peer pressure. Parent involvement is important. Tertiary prevention focuses on treating children who already start smoking and educating them about programs that can help them quit smoking. School and community counseling programs are other helpful preventive strategy to help children in dealing with tobacco withdrawal symptoms. Nicotine patches can be useful in helping children to stop cigarette cravings. Chewing gum also has been effective with strategy in stopping cravings. Nurses can use 5 A's to help patients quit smoking. Firstly, ask. Ask about tobacco use every time. This is essential for identifying the patient's tobacco use. Ask patients about their current and past smoking patterns. Secondly, advise. Urge tobacco users to quit. Advising the patient to quit should be done in a clear, strong, and personalized manner. Be willing to listen non-judgmentally to his or her concern about quitting tobacco use. Thirdly, assess. Determine willingness to make quit attempt. Assess how ready the patient currently is to quit tobacco use. Stages of change assessment are useful in addressing the extent to which person is ready to change. Next, assist. Provide help to move the individual toward a successful quit attempt. You can assist by helping him or her develop a personalized quit plan with a quit date and offer an array of effective treatment options, such as medication, free telephone counseling, health department cessation service, individual or group smoking cessation programs. Lastly, arrange. Follow-up is the most helpful to do within the first weeks of quit date and can be either in person or via telephone.